All right, hello and welcome everyone to episode 2, Anatomical Position and Directional Terminology. So in this video, we're really going to establish the anatomical framework used to actually describe the human body, including what's called anatomical position, some different directional terminologies, and some clinically relevant anatomical language that clinicians use on a daily basis that you will also need to know for your board exams. So by the end of this video, you will be able to describe the standard anatomical position and explain its importance as the universal reference position. You should be able to define and apply major directional terminology, including some different terms here. You should be able to differentiate clinically relevant directional terms, such as those listed there. And you should be able to apply anatomical terminology to anatomical relationships, different clinical scenarios, and different types of board questions. So with that, let's actually begin. So why does anatomical language actually matter? So to start, it creates a universal language. It's going to allow healthcare professionals of all different types to describe the body in a consistent manner. This is going to help prevent confusion. So the anatomical terminology that we're going to discuss always refers to the patient's perspective. So their right, their left, etc. It is essential for proper anatomy and diagnosis. So these same anatomical terms are going to carry over in imaging, palpation, orthopedics, neurology, any type of clinical care. It's all universal. Also, the reason you're here, you're studying for the NBCE exams. This is high yield content. You need to know these terms, even if they don't ask questions directly about them. You need to know them because they're going to be in question stems as you continue through part 2, 3, and 4. So key principle here, anatomy always assumes a standard reference position, and the directional terminology, is always going to be based on this position. So anatomical position is the standard reference position of the human body, as you can see here. So we have on the left, we have an anterior view, then we have a lateral view, and then we have a posterior view where we are looking at the front, side, and back of the body respectively. So what is the anatomical position? Because they can ask you questions specifically on this and they expect you to know it cold. So the body is standing upright. The head and eyes are facing forward. The arms are positioned nice and relaxed at the sides. And the most important point, the palms are facing forward, or also called supinated, and the feet are flat and facing forward as well. This is the anatomical position. So everything you talk about regarding anatomy, directions, biomechanics, it's all based off this starting position. So let's get into some common directional terms now to kind of talk about how we can orient ourselves from this anatomical position. So you can see here, there are approximately 7 really high yield terms that you 100% need to know cold for the NBCE board exams, but also for real life practice. So we're going to cover these one at a time now. Superior and inferior are the first terms we're going to cover. You may also hear these denoted as cranial and caudal, respectively, depending on who you're talking to, what country you're in, what their preferences are. So when we talk about superior, we are really referencing anything toward the head or upper part of the body. So you can see that we have our guy standing in anatomical position here. The arrows are denoting what superior is and what inferior is. So as an example, the head is superior to the chest. So if I get my laser pointer here, the head is above the chest. They mean the same thing. If we look at inferior now, this is referencing anything toward the feet or lower part of the body. So the chest now is inferior or below the head. And there is a kind of a key point here that I definitely want you guys to know. Superior and inferior really are used to describe relationships in the axial body, or also called the axial skeleton. So this is this highlighted area in green here. We'll get into what the axial body is and what makes it up in another video, but for the sake of terminology, you would use superior and inferior when you're talking about anything in this area most of the time. So you would not say, my hand is inferior to my head, because that's an extremity and that's an area that is outside the green highlighted area. So there's another term we would use for the extremities, for example. And just to demonstrate the cranial versus caudal relationship, because they really do mean the same thing, I have the lateral view in anatomical position here. So you can say the head is cranial to the neck, or the head is above the neck, or you can say the neck is caudal to the head, so the neck is below the head. Caudal really is talking about, it's more referencing toward the tail, which is our tailbone, our coccyx. So it's indicative of a downward direction. So the next set of terms we're going to talk about are anterior versus posterior. You may also see this as ventral versus dorsal. And again, you do need to know what ventral and dorsal is, as well as in the previous example of cranial versus caudal. They're not going to be as commonly used, but they will use them to try to trip you up on questions sometimes. So now, anterior is referencing anything toward the front of the body. So we can see this guy on the left, that is the anterior aspect of the body. An example here, the sternum, or the breastbone, right in the center of your chest, is anterior to the vertebral column or the spine. So the sternum is essentially in front of the spine. If we look at posterior now, that's this guy all the way to the right. You can see his back. This is going to reference anything toward the back of the body. So the vertebral column is posterior to the sternum, or the spine is behind the sternum. So really the anterior and posterior relationship is describing these front to back relationships based in this anatomical position. So you can see the lateral view. I have A for anterior and P for posterior, just marked on the slide here so you can see which side is which. And now we have medial versus lateral. So medial is going to reference anything toward the midline of the body. So you can see our guy standing here in reference anatomical position, and there is the midline drawn right down the middle of him, essentially splitting him in half into the left and right. So that is the midline. So anything that is closer to midline is going to be more medial. An example, the chest is medial to the arms. If we look at lateral, this is going to be anything farther from that midline. So the arms are lateral to the chest, or farther away from midline. Here's a little bit of an example. So we can see that arrow kind of starting at midline and moving outward. So the farther out we are, the more lateral we are, and the farther in toward midline, that we are more medial. So now proximal versus distal is the next set of terms we're going to discuss. Proximal is going to be anything closer to the trunk or point of origin. So when we talked about that axial body in previous slides, which was that area highlighted in green, that is the trunk or the point of origin. So now we're really talking about the extremities. So the elbow is proximal to the wrist, or closer to the trunk than the wrist. When we look at distal now, I think usually like distance away from the trunk. So it's farther from the trunk or point of origin. So the fingers now are distal to the wrist. They're farther from the trunk. And then the key point here is these terms are primarily used to describe relationships in what's called the appendicular body, or the appendages, the extremities, the arms and the legs, including the shoulder and pelvic girdles. So this is similar to how superior and inferior are commonly used for the axial body relationships. So if you take a look at this area in green here, if you're describing anything in reference in this area, you are using proximal and distal, not superior and inferior. Okay, now we have superficial versus deep. And for this, we have a picture or a CT scan of the brain. So you can see this thick white border. That is the skull with the frontal sinuses. And then in here, of course, we have the brain and the ventricles and all the things. So superficial is going to reference anything closer to the surface of the body. So think the more outside the body you are more superficial. And here are some examples. The skin is superficial to the muscles, and the skull is superficial to the brain. So you can see kind of the closer we are toward the outside of the body, such as the skull, that is going to be superficial to the brain. When we talk about if something is deep or not, we are farther from the surface of the body. So this one's kind of self-explanatory, right? The lungs are deep to the rib cage. The brain is deep to the skull. And a lot of this, again, is self-explanatory. It's kind of just me word vomiting at you. It really is just practice, just getting comfortable with the terms and when to use them. So, feel free to 2 times me and let's get through this video together. All right, and now we have ipsilateral versus contralateral. So when you use ipsilateral, this is going to reference anything located on the same side of the body. So you would say the right arm is ipsilateral to the right leg. They're both right-sided, they're both on the same side. When we look at contralateral, this is going to be anything located on the opposite side of the body. So the right arm is contralateral or opposite to the left leg. So the key point here, especially important when describing symptoms, neurological changes such as weakness, reflexes, radiating pains, different kinds of paresthesias. This stuff becomes vital when you are documenting notes. So ipsilateral, same side, contralateral, opposing side. So the last set of high yield terms is bilateral versus unilateral. Bilateral is going to be anything present on both sides of the body. So the patient reports bilateral shoulder pain. They have pain in both shoulders. Unilateral is going to be used when you present on one side of the body. Uni is kind of a prefix for one. Think of like a unicycle has one wheel or one tire. So the patient reports unilateral low back pain. Their low back pain is localized to the right side or just to the left side. So I usually just use something simple like the B in bilateral is for both sides. And just like with the ipsilateral versus the contralateral, this is commonly used in clinical documentation, diagnosis, and patient presentations. You absolutely need to know what these terms mean. Bilateral, both sides. Unilateral, one side only. And that's it for the high yield terms. Now I'm going to cover some of the more moderate to low yield terms. You definitely need to know what these mean, but they're probably not going to yield that many points. If they're even asked about directly at all, they probably might show up somewhere in a question stem. Maybe they'll help you get through future classes if you're studying for part 1. But these aren't going to be as high yield as some of the others. So the first moderate yield term here is intermediate. This means positioned between two structures. And there's a couple different ways in which we can use this one. We can reference it like the clavicle or the collarbone, highlighted here in this blue-green, is intermediate between the sternum and the shoulder. So you can see how it's located between. Inter is really a prefix that means between. So if you remember that, then you can never forget this. So the other way that intermediate can be used is to describe anatomical layers located between superficial and deep structures. So you see this picture of some of the layers of the human skin here, and the labels are there for you. But so you can see the dermis is intermediate between the epidermis and subcutaneous tissue. It is essentially literally between them. So you can use intermediate as another term to describe that. Now we have internal versus external, also kind of self-explanatory, but there is an important nuance here. So internal, think inside, is toward the inside of a structure or body. So the nasal cavity is internal to the nose. So the nasal cavity is kind of the open space in the nostril. That's what I'm referencing. So external would be anything toward the outside of a structure or body. So the nose is external to the nasal cavity. And the important point with these terms is that internal and external is not the same as superficial and deep. So you would not say that the nasal cavity is deep to the nose. That's kind of weird, right? It's just an empty space. It doesn't really make sense to use superficial or deep in this scenario. So you would use internal and external. So now we have central and peripheral. So think of central as anything closer or toward the center of a structure or body. So in this image here, the closer you are to that dot in the middle, the more central you are. The spinal cord is central to peripheral nerves, right? The spinal cord is kind of that center, and then the peripheral nerves come off the spinal cord and travel down the arms and down the legs, things like that. Peripheral is away from the center of a structure or body. So the farther away from central, I'm more peripheral. So think of peripheral vision, right? It's kind of out to the side. So peripheral nerves extend away from the central nervous system or the spinal cord. So another way that we can use central and peripheral is describing things like arteriosclerosis or just general blood flow. We have different cells that are going to flow more toward the center of the lumen of a blood vessel, and some that are going to flow a little bit more peripherally, more toward the edge of a structure. So this process helps to explain why plaques form in arteries when you get arteriosclerosis. And so you can use terms like central and peripheral to kind of describe some of the blood flow changes and how the plaque formation actually occurs. Parietal and visceral are definitely terms that you will need to know in general, though, especially to pass your classes. So parietal is going to be related to the wall or outer lining of a body cavity. So when we look at the lungs, the parietal pleura lines the inner wall of the thoracic cavity. So you can see in this image we have the lungs, and this parietal pleura is that blue around it. So yes, it's lining the lungs, but it's also lining the inner lining or the inner wall of the thoracic cavity in the chest. When we look at visceral, visceral is related to the actual organ surface or organ covering. So the visceral pleura directly covers the lungs. You can see that in red here. You have the lungs immediately surrounded by visceral pleura, and then the parietal pleura would be on top of that with a space in the middle. So parietal, cavity wall, visceral, think viscera or organ surface. So the final set of terms we're going to talk about is rostral versus caudal. We already talked about caudal referencing inferior. However, it's also used with this term rostral. So rostral is going to reference anything toward the nose or front of the brain. So the frontal lobe is rostral to the occipital lobe, right? It's closer to the front, it's more anterior, therefore we call it rostral. Caudal is going to be referencing that tail or back of the brain spinal cord. So you could say the occipital lobe is caudal to the frontal lobe. So you can see that in this image here, it kind of forms this curve. The key point is that this is most commonly used in neuroanatomy to describe positions with the brain and spinal cord. You often won't see rostral and caudal used outside of neuroanatomy. However, it can be, but again, really depends who you're talking to. All right, now let's get into some NBCE style questions regarding anatomical position and directional terminology. So the anatomical position is characterized by, take a look at these answer choices, pause the video and see what you get. And the right answer is C, palms facing anteriorly. So in anatomical position, remember the body is erect with the arms relaxed at the sides and the palms are facing forward or anteriorly. They are also called palms are also in the supinated position. So the correct answer is C, and this is probably the most common question you will get asked on anatomical position. Okay, next question. The sternum is blank to the heart. Take a look. And the correct answer is D, anterior. So remember that the sternum or the breastbone lies in front of the heart. So you would say that the sternum is anterior to the heart. Next question. The nose is blank to the eyes. The correct answer is B, medial. So remember that the nose is closer to the body's midline than the eyes, therefore it is medial. Proximal and distal are used for the extremities, and it is definitely not lateral to the eyes. Next question, the wrist is blank to the elbow. Remember, what terms are used to describe the extremities in the appendicular body? And the correct answer is C, distal. So the wrist is more distal to the elbow. It is farther from the trunk or point of origin. Distal, think distance. Another question, the heart is blank to the stomach. What is the best term to use here? The best term to use is B, cranial. So cranial means toward the head. However, you can also use superior. So even if it looks a little awkward, just try to think about what each term actually means and is referencing, and it can help you get the correct answer. Okay, now which structure is superficial to the muscles? So which structure is closer to the surface? The correct answer is B, the skin. The skin is the closest thing to the surface, therefore it is definitely superficial to the muscles. Now the spinal cord is blank to the peripheral nerves. What is the best term to use here? Central. Central is the best term to use here because it is referencing a position toward the center of a structure or system, in this case, the human body. The frontal lobe is what to the occipital lobe? What is the best term to use here? The answer is C, rostral. So remember, when we're talking about neuroanatomy, this is when you're going to see terms like rostral and caudal. So rostral is toward the front of the nose or front of the brain. So that's the term we're going to use here. A structure located between the epidermis and subcutaneous tissue is described as what? Answer is A, intermediate. So remember, you can use intermediate to talk about things between layers, like the epidermis and the subcutaneous tissue. The lungs are blank to the thoracic wall. So think about what the best term to use here is. I would say the best answer is B, internal. So the lungs lie within that thoracic cavity and are therefore internal to the thoracic wall. So this is more of an inside versus outside position rather than depth from the body surface. However, technically you can say that the lungs are also deep to the thoracic wall, but that was not an answer choice here. Final question. So a chiropractor palpates the spinous process of T6 relative to the sternum. The vertebra is what? How would you describe this relationship? I think C is the best answer here. Remember, the thoracic vertebrae are going to lie posterior to that sternum. They are behind it. Therefore, you would use posterior or dorsal. All right, so the key takeaways from this video. Anatomical position is the standard reference position with the palms supinated. Everything is erect, you're facing forward. This is the foundation for all anatomical terminology to build off of. You have the various directional terms that describe these anatomical relationships. You have the major pairs like the high yield terms listed right there for you. You have the more clinical terms like Ipsi and contralateral, bilateral and unilateral. You absolutely have to know both these major pairs and those clinical terms. And then we have some moderate yield terms here that you also definitely should know, but are not going to be as important for board reasons. So remember though, every directional term assumes anatomical position. So have that figure kind of stuck in your head as what you're referencing. So now in the next video, we're going to talk about body planes and anatomical sections. We're going to talk about what planes are, what sections are, what the differences are, and then how we actually use them to describe and map out the human body and how we map out motion. So this is going to be really important for medical imaging, kinesiology, exercise science, and tons of other various fields. But again, everything is going to be in reference to this anatomical position. So please, please, please know the directional terms, know what anatomical position is, nail it down before you start learning all the planes and everything else we're going to cover, because everything is just going to build onto those foundations. All right, thank you everyone, and I will see you in the next video.